Dr. Herb. Today we are going to look at the Rhinosporidiosis. So to begin with, first is what is Rhinosporidiosis? Rhinosporidiosis is a chronic granulomatous condition. It is chronic and it is granulomatous condition, and it is caused by the Rhinosporidium. It is the seaberry, Rhinosporidium seaberry. So it is recently reclassified as a member of the Protestant. So this also we need to know, Protestant mycetozoa. So mycetozoa. So let's learn more details that it is morely common in the southern states of, so it is present in south, more common in the southern states, that is you can say in case of South India it is most common. And whom does this Rhinosporidiosis mostly affect? So there is a higher chance in case of the immunocompetent individuals. Immunocompetent individuals, it is more common, and it is more commonly a waterborne disease. It is a more commonly a waterborne disease. Next is, what are the clinical features? The clinical features is that it includes, there is a blood-tinged nasal discharge. There is a blood-tinged nasal discharge. Next is, there can also be presence of frank epistasis, as well as there is presence of the nasal stuffiness. So there is blood-tinged nasal discharge, there is frank epistasis, as well as there is nasal stuffiness. Now let's look at what are the findings of this Rhinosporidiosis. So finding, it includes, there is leafy, there is presence of leafy, polypoidal mass. Next is, there is pink to purple. There is presence of pink to purple in color. There is pink to purple in color, and it is attached to a nasal septum or lateral wall. It is attached to a nasal septum or it is attached to a lateral wall. Then sometimes it extends into the nasopharynx. So sometimes it extends to the nasopharynx, and it may hang behind the soft palate, and it hangs behind soft palate. Then comes the mass. The mass is very vascular. So the mass, it is very vascular and it bleeds easily on touch. So it bleeds. There is bleeding in case of bleeding on touch. So it easily bleeds on touch, and its surface is studded with white dots. So if we look at its surface, it is studded with white dots. So there is studded. It is studded with white dots, and this represents the sporangia. It represents the sporangia. Next, looking at diagnosing. So on diagnosing, you must find the biopsy. So in biopsy, it shows a sporangia. Next is, we look at the histological section. The histological section. So histological section, it shows a sporangium. It shows sporangium, and it is fully packed with immature. So it is packed with the immature sporoblast. This is usually seen in case of the histopathology slide. So there will be immature sporoblast as well, and this will be at the periphery and mature ones at the center. So this immature will be at the periphery, and when you look at center, what is present. In case of center, it will include the mature ones. So in terms of center, there will be the mature ones. Now let's look at how to treat this. So how to treat the rhinosporidiosis. So the treatment of rhinosporidiosis will include, there will be a complete excision. So you do a complete excision, and this will be of the mass. So complete excision of the mass with a diathermy knife. So use a diathermy knife. So complete excision of the mass with the diathermy knife, as well as what you do is the cauterization of its base. Cauterization of its base. So recurrence may occur after a surgical excision. So if you see the recurrence, it occurs after the surgical excision, and they can also be used of dapsone. So the dapsone can also be used. So this was all about rhinosporidiosis. We saw what is the definition, we saw what are the organisms affected, we saw some very important findings of rhinosporidiosis, knew how to diagnose them, and saw what are the major points in case of the histology as well as the treatment. So to learn and grow daily like this, please do subscribe.